Welcome to this Deaf and Hard of Hearing Awareness Training course, Part 1. I'm Jo Virgo and I'm an occupational therapist by background. To get the most out of this training course, please observe the following advice. Break it up. Online learning can be tiring. Take breaks when you need to. Don't be a passive participant. There are various activities to complete throughout the course which promote a deeper level of learning and will aid memory. Take notes. This will also promote a deeper level of learning and will assist you with the completion of the workbook. Repeat. If there's anything you don't understand, please do watch the video again. Individual or group learning. If more than one of you from the same team are booked onto this course, then you may wish to undertake the training together, as this will foster discussion and reflection. However, do complete the workbooks individually, and obviously bear in mind your own policies with regards to COVID-19. Ask. If you're unsure about anything, please feel free to contact me at jo.virgo@eastsussex.gov.uk. By the end of this session, participants should be able to identify the causes and types of hearing loss, understand the impact of hearing loss, appreciate how to communicate with people who are deaf or have age-acquired hearing loss, and be aware of the deaf culture and sign language. To begin the session, let's see how much you already know about people who are deaf or hard of hearing. Please pause the session and complete the quiz before you continue with the remainder of the course. You will find the link to the quiz in resource number 7, slide 4. Please pause the presentation now, complete the quiz, and I'll see you on the next slide. Deaf and hard of hearing defined. So to be deaf, it is the inability to usefully perceive sounds in the environment with or without the use of a hearing aid. Inability to use hearing as the primary way to gain information. So this basically means the person has severe hearing loss. So to be hard of hearing, you have sufficient residual hearing to be able, with a hearing aid, to comprehend others' speech and oral communication. So your prime means of communication is verbal. People who are hard of hearing will vary in the levels of hearing loss they experience, and we shall look at this later. Hearing loss prevalence in the UK. So within the UK, there are 12 million people who have hearing loss of some level, and that's approximately 1 in 6 people. 8 million of these are aged 60 and over, and it's estimated that 900,000 people have severe or profound hearing loss. Furthermore, more than 40% of people over 50 years old have hearing loss, and this rises to 71% of people over the age of 70. Due to an ageing population, hearing loss is on the increase, and it's estimated that by 2035, 1 in 5 people will have hearing loss. At the moment, approximately 24,000 people across the UK use British Sign Language as their main language. However, due to the prevalence of cochlear implants, a lot of parents are choosing these for their babies, so British Sign Language may be on the decline. Types of deafness or hearing loss. It's useful to think about this with regards to 4 distinct groups. The first being those people who are hard of hearing. This makes up the majority of people with hearing loss. So they've normally lost hearing through the ageing process. And these people normally retain some degree of hearing, either with or without a hearing aid. Second, there's those that are deafened. So these people have lost all useful hearing, and they probably become deafened after they have acquired speech. This may have occurred gradually over time or suddenly due to a traumatic event. Third, there's deaf. And these are a distinct cultural group and user of British Sign Language. These people normally they were born deaf or they became deaf at an early age, prelingually. This group of people is likely to use British Sign Language as their first language or preferred language, and they identify themselves as deaf with a capital D. Deaf people have a strong cultural as well as linguistic identity. Then there's those that are deaf-blind, also known as dual sensory impaired. So these people can they were either born deaf and blind at birth, or they were born with one sense, either hearing or sight, and gradually lost the other sense over time. And then finally, there's deaf blindness that can be age acquired. So that's the gradual loss of both sight and hearing during the aging process. Early versus late onset hearing loss. It's very important to distinguish between adults who have experienced an early onset of severe or profound hearing loss and adults whose hearing loss was acquired later in life, as the experience between these two groups and their needs will be different. Early age. So this is normally before the age of 2, before language development. The impact of on the development of spoken language and reading ability and educational attainment will be affected. Deaf children are unable to hear speech sounds that make up spoken language, and this is what written language is based upon. At a later age, which is after the development of the spoken language, people should be able to articulate words and be understood by hearing people. The later the onset of hearing loss, the greater the spoken language and reading ability will be. Also, they will experience a loss of hearing, unlike people who were born or became deaf at an early age. So again, this is a different experience. So what causes deafness and hearing loss? Well, there's basically two types. The first is conductive, and this type of deafness is usually temporary, with a loss of volume with no distortion. And this is normally caused by a blocked ear canal or perforated eardrum. These aren't really the people we're talking about today. The people that we're referring to today are those with perceptive or sensory neural deafness, and this is normally permanent. And this affects the perception of sound. And the causes include age, exposure to loud noise, tumour, injuries, a virus, hereditary conditions such as cochlear or auditory nerve damage. So these are the people that we're talking about today. So how does hearing actually work, and how does external sound reach the brain and is interpreted? The ear comprises of key structures to ensure that sound is captured by the outer ear and travels to the brain where it's interpreted. There's a video to watch in your resource number 7, slide 10, and the key words I'd like you to look out for are outer ear, ear canal, eardrum, the 3 types of ear bones, the cochlea, the hair cells and the auditory nerve. A blockage or damage to any of these structures affects hearing. So when viewing the video, think about how damage to these key parts of the ear could affect the person. So if you pause the video now, and I will see you on the next slide. Age is a significant factor for hearing loss. From the age of 30, when we wake up each morning, we have less hearing than we had the day before. So age is one of the largest risk factors for hearing loss. Basically, hearing loss occurs when the tiny hair cells are damaged or die. So you would have seen that in the video previously. And these hair cells do not regrow. So most hearing loss caused by hair cell damage is permanent. There's no single cause of age-related hearing loss. However, it is thought that it's caused by changes in the inner ear that occur as you grow older. There's also genes and loud music that play a large role. Measuring sound. Sound is measured in units called decibels. The higher the decibel level, the louder the noise. So on the infographic here, you can see that an increase of 10 means the sound is 10 times more intense. So if we look at the sound of breathing here, which is 10 decibels, the next sound on the scale is the sound of rustling leaves, and that is 10 times as loud as normal breathing. Noise above 80 decibels over a prolonged period of time may start to damage your hearing, as it damages the tiny hairs in the ear, and over 80 decibels is represented by the lower half of the infographic, which starts here. Also, loud noise above 120 decibels, which is illustrated here, can cause immediate harm to your ears. There is also employment-related exposure to noise, that is working in a noisy factory, the army, and for example, veterans, the noise of guns and bombs near their ears consequently result in veterans having hearing loss. And there's a service that you might find useful to know about, and that is the Veterans Hearing Fund, and they can provide hearing technology and other assistive listening devices for ex-veterans who've experienced hearing loss due to their work. So levels of hearing loss. Normally this is measured by an audiologist. Full hearing ranges from 0 to 20 decibels in all frequencies, and that's in both ears. So if you see on the chart here, if you have mild hearing loss, then you can't hear anything below 20 decibels. And you may not be able to hear anything under 30 decibels as well, but you're within the mild hearing loss range. Now, moderate, you aren't able to hear anything under 41 decibels, and severe, 71 decibels, but profound hearing loss is normally 95 decibels or less. So someone visiting an audiologist will normally have a report which specifies the hearing loss that they have in each ear, and this indicates the total level of hearing loss. So the following table shows the levels of hearing loss in relation to the noises within the environment. Within your resources, you'll find a table that provides an overview of each level and its impact on hearing, environmental sounds and speech. And you'll find this in resource 1, but it's on similar lines to this table here. So you can see that normal hearing, you should be expected to hear a bird cheeping and leaves rustling. But somebody with severe hearing loss may not even be able to hear a dog barking there. But if you refer to your table, there's quite a comprehensive list of all the noises and impact on speech. So what does hearing loss actually sound like? You'll find in resource 7, slide 15, a link to an audio with different levels of hearing loss. What I'd like you to do is listen to that video and reflect on the following. How do you think this would impact on phone conversations? And what impact do you think this could have on communication and relationships? So if you pause the presentation now, listen to the video, and I'll join me on the next slide. Now, a lot of people with hearing loss will experience tinnitus. Tinnitus, and so hearing loss is a common factor underlying tinnitus. Tinnitus is hearing noises that are not caused by an outside source, and it's often described as ringing in the ears, although several sounds can be heard, such as whooshing, buzzing, humming, grinding, hissing and whistling. The sound can be in one or both ears. It can be constant, occasional, loud or soft. So what does tinnitus actually sound like? You'll find a video in your resources, so it's resource 7, slide 17, and there's a link to a video, and this is a sound simulation of tinnitus, so it'll give you an idea of what tinnitus actually sounds like. So please adjust your volume to a lower setting, and also if you feel uncomfortable, please stop listening to the audio. After you've watched the video link, think about what impact you think this would have on you if you experience this during a conversation, and what do you imagine the long-term effects would be. So please pause the video now and join me on the next slide. So there are things you can do to manage tinnitus. One is to reduce your stress levels, however best that is for you. Use relaxers or maskers. These are basically sound generators that can distract or mask the tinnitus. Hearing aids may also help. Listening to background sounds such as a radio or music. And also some people find it useful when going to sleep to put the radio on an off station setting so it creates an ambient of white noise. This can also help people. There are also alternative therapies, counselling, clinical psychology or tinnitus retraining therapy that people can access. The impact of deafness on a person. So this is the group we referred to as being deaf or deafened, where the person has no or very little hearing. So sensory loss cuts across all ages and client groups, although it's more prevalent in some than others. Difficulties are caused by social and environmental barriers as much as by the sensory loss itself. The barriers are less physical and therefore they're less obvious and less noticed. And they impact on a person in 4 ways. One is communication, another is access to information, the third is participation in life, work and daily activities. And it can also impact on health, well-being and mental health. So communicating with hearing people. There's a general lack of awareness within the general population about how to communicate with people who are deaf. Deafness is also, it's not as obvious and it can be mistaken for cognitive problems or being difficult or challenging. Also, communicating through spoken or written English poses many challenges to deaf people as it isn't their first language. And studies show that only 30 to 45% of the English language is discernible through lip reading. Furthermore, there's many factors that can affect a person's ability to lip read. And one problem is that many words use the same lip shapes. So for example, if you say elephant shoes, it uses the same lip shape and pattern as when you say I love you. So it is very difficult to lip read, and so it's understandable that you can only discern 30 to 45% of what is communicated via lip reading. Okay, so there's a film in resource 7, slide 22, and it's a very interesting film and it highlights the difficulties of lip reading, especially for people who use sign language as their first language. So if you pause the video now and watch the video and join me on the next slide. Okay, so now it's your turn. So there's a lip reading activity and you'll find that in resource 7, slide 22. So there's a link to the activity there. So see how you get on and I will see you on the next slide. Accessing written and audible information is also very difficult for people who are deaf. The average reading age of deaf adults is 9 years old. Deaf BSL users have problems understanding written information because remember, English is not their first language. Spoken information is also difficult to access, especially if there's no text substitute. For example, announcements in public places. There's also a risk of low fund of information. So this is the knowledge that hearing people tend to accumulate from casual conversation or just hearing media in the background. This can lead to a lack of knowledge about many things within the world. Participation in daily life. Deaf adults in the UK often occupy poorer socio-economic positions and have poorer literacy rates, and they also have limited access to communication through speech. They have fewer educational and job opportunities, and they have less opportunity to interact and form relationships within their local community, for example, neighbours, the church and local shops. Being deaf can also impact on health, well-being and mental health. A report showed that deaf people are suffering from preventable and potentially life-threatening illnesses due to access limitations and misdiagnosis and poor treatment. You will find a link to the Sick of It report if you'd like more details. Furthermore, deaf people have an increased vulnerability to mental health issues, and it's been estimated that there's 30 to 60% of the deaf community that are experiencing mental health issues. You will find more information on resource 7, slide 26. However, on the positive side, technological advances have improved the lives of deaf people. And you'll find this via video telephony, which is FaceTime and WhatsApp. No longer do they need to rely on text, which is their second language, but they can actually sign to one another. There's also interpretation apps available and sign recognition software. So if you are interested to see how this technology works, then please see a link in resource 7, slide 27 for more details. Okay, so what is the impact of age-related hearing loss? Well, it's going to affect people's communication and participation in social life, and it can also impact on well-being and mental health. And this is due to people who were born hearing being unable to follow speech with or without hearing aids, because remember, lip reading isn't going to be a skill that they've developed over time. And this hearing loss can lead people to withdraw from social situations. They can experience emotional distress and depression, and research shows that it increases the risk of loneliness, but only for those who don't wear hearing aids. Another risk that's being investigated at the moment is people with mild hearing loss have twice the risk of developing dementia when compared to people with normal hearing. And this risk increases threefold for people with moderate hearing loss and fivefold for people with severe hearing loss. Evidence suggests that hearing aids may reduce these risks. So what things do we need to consider when working with somebody with hearing loss? This section now looks at the impact on assessment and care planning. Individual needs. So as with other conditions, people with hearing loss will experience their hearing loss differently and will have their own specific needs. So it's still viewing the person as an individual with their own individual needs. And the impact will differ depending on a range of factors. First is the nature and degree of the hearing loss, the age of onset, the impact of other impairments or disabilities, and the extent to which the person has accommodated their hearing loss. Also, what social support do they have, and what coping strategies and resilience do they have? So the purpose of an assessment and care plan is to identify what support somebody needs and how to meet those needs. So therefore, it's essential that the client can understand you and you can understand them. So therefore, a good assessment is that you have a clear identification of the person's care and support needs, and that you customise the level and type of support for each person based on these needs that you've identified. So if you don't understand what they've said to you, what their needs are, and they don't understand you, then you could have an inaccurate or omission of needs. And this can lead to incorrect care planning and needs continuing to be unmet. This can therefore impact on health and well-being and can also increase the risk of harm. So it's essential that you get the environment right and identifying hearing loss at the outset. So how can we identify whether somebody has hearing loss? Well, first of all, they may not be able to hear the doorbell or you knocking at the door, so this is a good sign. Failure to respond to spoken words. Provide unrelated responses to questions. Ask you to repeat the question. They may move towards you. They may have the TV or radio on very loud. They may be unable to hear the smoke alarm test. Or there's reports of being more withdrawn and not socialising as often as previously. You'll find a self-report questionnaire in resource 2 that you could do with your clients if required. Maximising communication and access to information for people with hearing loss. Since 2016, the Accessible Information Standard is a law which aims to make sure people with a disability or sensory loss are given information they can understand and the communication support they need. So it's giving equal access to everybody to access information. So it's a mandatory standard for health and social care, and it has a dual focus to enable people to access information, however form that will be, written, audio or visual, and to enable people to communicate with others. Now this is particularly relevant to people who are blind, deaf or have hearing loss or are deaf-blind. So essentially within your practice you should be asking people whether they need information provided in a different way to what is already available. And do they need any communication support? And also, how would they prefer to have this information? So would they prefer to have it in an easy read document? Would they prefer it in larger print? Do they need a BSL interpreter? Would they prefer the information to be in Braille? Would they prefer appointments being emailed or texted to them? Or is there any other information support they need? So it's what the person would prefer, and that's what you need to be asking clients when providing any information. A new law has just come in September 2020 in relation to making websites more accessible to everybody. So any organisation which is in part funded by the public purse needs to make sure their websites and documents are accessible to all. So what this means with regards to deaf and hard of hearing people is that anything on the website needs to be in plain English, and that is have a reading age of 12. However, as we've seen, people with profound deafness may not have a reading age of 12, so it still may not be accessible. And also there needs to be closed captions or subtitles for videos included. However, there is nothing that says that information needs to be provided in British Sign Language. So it still doesn't actually meet the whole needs of everybody. When conducting an assessment or care planning discussion with someone with a hearing loss, you need to think about how you're going to conduct the session and where you're going to conduct it. So there's a few things here for you to consider. First of all, identification of a comfortable and safe location, which has minimal background noise. And also check the acoustics for hearing aid users. Also, you may want to check if there's a loop system. Now, a loop system is sometimes called an audio induction loop, and it's a special type of sound system for use by people with hearing aids. The hearing loop, it provides a magnetic wireless signal that's picked up by the hearing aid, when it's set to T, that means telecoil. Not all hearing aids have them, so it would be useful before somebody gets a hearing aid for them to check whether they can have a T mechanism added to their hearing aid. Also, do they need any listening equipment? Are the conditions for lighting good? And are you going to be free of any interruptions? Make sure there's minimal visual distractions and ensure that you book an interpreter in advance. Actions to avoid when having a conversation with someone with hearing loss is to not cover your mouth, as they may discern some information from lip reading. Also, don't turn away or mumble. Try not to speak over one another if you're in a group setting. And there's no need to articulate words, just use your normal lip pattern. So communication etiquette. These behaviours will ensure that you take the right approach and complement the previous elements. So gain the person's attention first. Approach them from the front, introduce yourself, speak clearly and check they can understand you. If they have any residual hearing and sight, find their best side. Now ask them which is their best side. Communication is likely to involve touch and is probably more physically close, and especially within the deaf community. And be patient. Communication might be slower than usual, or it may take a little longer. So to maximise communication, always maintain face-to-face contact. Use clear speech and normal lip patterns. Ensure there's an adequate distance, so not too close, not too far away. Use natural facial expressions and gestures. And there's no need to shout. This can be uncomfortable and it can also appear very aggressive. And try to rephrase rather than keep repeating sentences over and over again. And please try and use plain language or avoid jargon, unfamiliar abbreviations or acronyms. Also, try to use a lower pitch or tone, because higher frequency pitches are those that are lost first with regards to hearing loss. Also, write information down if appropriate. Allow extra time. And you can also use objects of reference for people who are deaf. So you could actually pick up maybe a pen and mimic writing something down, and this will make it more understandable. So you can use objects of reference, but you'd normally only do that with someone who's profoundly deaf, and in that case you should have an interpreter present anyway. Deaf culture and communication. So what is deaf culture? Deaf culture is a set of art, behaviour, tradition, values, social environment and shared institutions of communities that are influenced by deafness, and they also use sign languages as a mean of communication. Now, the deaf culture is recognised under Article 30 of the Convention on the Rights of Persons with Disabilities, and this states that persons with disabilities shall be entitled on an equal basis with others to recognition and support of their specific cultural and linguistic identity, including sign languages and deaf culture. When you are deaf, you see the world in a different way. You communicate differently. You seek out others who are deaf because they understand you. You don't believe you have a disability and you don't want to be fixed. And this was written by deaf advocate Eileen O'Banion. Now, terms to avoid when referring to people who are deaf are the following: deaf and dumb, deaf mute, or hearing impaired, because deaf people do not see their hearing loss as an impairment. There are two main views of deafness. One is the pathological and the other is socio-cultural. And the pathological is based on the medical view, and it sees deaf people as being sick or disabled. The socio-cultural view, on the other hand, just views deaf people as different and their way of communicating as being different. The pathological view sees deaf people as being intellectually inferior, whereas in fact there's no difference in mental abilities at all. Pathological view sees deaf people as having limited abilities, whereas the only ability they don't have is the ability to hear sound. The sociocultural rightly believes that people who are deaf have unlimited abilities, the same as somebody who's hearing. Pathological view sees deaf people as being speech impaired. However, they're not. They actually have an indigenous sign language communication. The pathological view also sees deaf people as being culturally deprived. However, they belong to a unique culture and it's very rich in history. The hearing culture versus the deaf culture. So in hearing culture, we believe that pointing is rude. However, in deaf culture, pointing is permitted as it's part of their sign language. In hearing culture, eye contact isn't necessary because we can hear the person if we turn away. However, in deaf culture, eye contact is mandatory. Talking with our mouth full is seen as rude in hearing culture, whereas deaf people can talk with their mouth full as they can sign with their hands. Hearing people often have just a short goodbye. However, deaf culture has a very long goodbye. They start because they love to be with other people that speak their language. So it's quite an elongated process. Deaf culture in the UK. History records the existence of a sign language within deaf communities in England as far back as 1570. And the first deaf school was established in 1760. Throughout the establishment of deaf schools, there's been a lot of controversy over manualism versus oralism, particularly oralism where children are expected to learn via lip reading. And as we saw in the previous slide, you can only gain approximately 35% of knowledge or understanding from lip reading. And in some schools, sign language was actually banned, so children were not allowed to use their native language. And there's some videos, you'll find some links in resource 7, slide 48, and there's some very interesting documentaries about the history of education for deaf people. Deaf clubs, these were very popular up until recently, but now there's video conferencing available. Deaf clubs have been closing down, which is a shame because it was a great meeting place for people who are deaf and family members who were hearing, and everybody socialised together and gained information. So that's a sad loss, really. And also when it comes to the arts, deaf people normally perform showing people the world from a non-auditory perspective, and it's very visual in nature. So a lot of art and literature will be around viewing the world from a non-auditory perspective. And also deaf people are able to participate in creating music and enjoying music from vibrotactile products. So you can actually, I've put some links again in resource 7, slide 48, and you can find out about how this vibrotactile technology works. Sign language. British Sign Language. Sign language is used in the UK and is the first or preferred language of some deaf people in the UK. It's a visual means of communication with its own grammatical structure and syntax, and it's the preferred language of around 145,000 people in the UK. It's also a recognised language in its own right. However, it's not legally an official language and the deaf community is still campaigning for this. Sign-supported English. Now this isn't a language in its own right and it uses the same signs as BSL. However, it does have the same grammatical structure as spoken English. And you'll find that a lot of hearing people who have learnt sign tend to use sign-supported English. Deaf communication etiquette. When meeting somebody who's deaf, it's common courtesy to use a sign language greeting. Always introduce yourself first and use the sign language alphabet to fingerspell your name. Make and maintain eye contact when communicating and try not to stand where bright light or sun is directly behind you because they will only see a silhouette of you and they won't be able to see your actual signing. And never cover your mouth with your hand. The alphabet is completed with fingerspelling and there are different hand shapes and movements and locations. They can be used on the right or left hand, and this one here that I'm showing you is right-handed, but there's also one for people who are left-handed. The vowels are normally represented by the top of the fingers on one hand. So for example, the A is tapping your thumb, the E is tapping your index finger, the I is tapping your middle finger, the O is tapping your ring finger, and finally U is represented by tapping your little finger. So those are the vowels. So what I'd like you to do next is to have a go yourself. So you'll find on your links, resource 7 slide 52, you'll find fingerspelling, numbers and greetings. So it would be quite useful for you to learn how to spell your own name and to learn one of the greeting signs. And also maybe you could practice using a number as well. So maybe say how many children you have or how many pets that you have. Okay, if you pause the video now and have a practice, and I will see you on the next slide. Specialist communication support. So for people who are profoundly deaf and their preferred way of communicating is British Sign Language, you will need to get a British Sign Language interpreter. So these people have been trained to level 6 in British Sign Language and they have interpreter status. There's the speech-to-text reporter, commonly known as Minicom. However, this isn't being used as much as it used to be because of social media and video conferencing technology. There's lip speakers as well, and these people have been specifically trained to make their lips easier to read for people who are hard of hearing. And there's also Makaton, which uses the similar signs to BSL, but doesn't necessarily have a grammatical structure. And these are for people who also have a learning disability as well. So this is the end of part 1. Thank you very much for attending and I hope you enjoyed the course. And I'll see you in part 2. Thank you very much.